Okay, so judging by my thumbnail that you probably saw and clicked on, you're wondering, how is it that Medicare wants me to die broke? And that's probably what you want to hear in this video. So I'm going to show you some raw data as to why I think that Medicare wants to take all of your money and doesn't want you on original Medicare. They want you off of it and they want to bleed you out of your money. So let's take a look right now. This is from kff.org. They have great charts on here. One of these charts that is pretty easy to look at and see what's going on is the total Medicare Advantage enrollment from 2007 to 2023. Now, in a lot of my videos, I probably should have shown this chart because in 2008 and 2009, I talk about how I was taking people off of Medicare Advantage, putting them on original Medicare with most likely a Plan F or probably a Plan G back then. I can't remember. But that's all that I did. I had so many people. These are people that I went out to and met them for the first time that were complaining about their Medicare Advantage plan. Number one, it was over $100 a month for their plan. When a Plan F was $120, their plan was $110. So it didn't make any sense. You were paying nothing at the hospital and doctor for Plan F, but you're paying $110 for a Medicare Advantage plan where you have copays and deductibles. So take a look at this chart. So in 2007, we had 19% of the people that were on Medicare, that enrolled in Medicare, were enrolling into Medicare Advantage plans. By 2023, it's over 50%. And why is this? It's pretty easy to figure this out. They are handing you everything to get on these plans. And in this video, I want to show you what they want to do with you because it's my belief that they want to get everyone, as many people as possible, into these plans. It's private insurance. Then you can't get out of the plans. And then they're going to start skyrocketing the premiums, number one. Number two, the deductibles, copays, and the rejections from going to do certain things like going to certain doctors and denying claims. How do I know this? Well, let's just take a look at one of these articles that I saw. This is from NBC News. Deny, deny, deny. By rejecting claims, Medicare Advantage plans threaten rural hospitals and patients, says CEOs. This is what happens to a lot of people. And I want to show you, I'll jump into this and then I'll jump over to how they do this. So just bear with me for 1 second. So right here, this woman talks about it was a mess. I didn't go to the doctor because I was going to have to pay out of pocket money I didn't have. This is what happens with Medicare Advantage plans. And this happens with, a lot of times, high deductible plans. This is why a lot of people that want to get on a high deductible G, they think twice and they end up going on a Plan N. I see this every single week in my office because people get nervous about, am I going to spend this money? But with the Medicare Advantage plans, people say, I'm not going to go to my specialist that costs $35 or $50 because I don't have the money. They're going to send me to do something else. And they don't get the health care that they need. If you're on a Plan G or a Plan N, most people go and they go as much as they want because they realize this is what I'm going to be paying. And even if the doctor tells me, hey, you got to get some more testing or we need to do this surgery, they know it's covered. But if I skip over to what a Medicare Advantage plan, how they trick you, and I show you, let's just scroll up a little bit here. So this is how it starts. You look at the premium, and it starts with the zero premium plan. Now, from most, I think it's like 90% of the plans out there, from what I see, even PPOs, are zero premium. They give them to you for free. Now, this particular plan has a zero drug deductible, zero health deductible. Pretty easy. Hey, 0, 0, 0. The maximum out of pocket is $4,700. So you say to yourself, well, that's not so bad. $4,700 is the max that I'm going to pay. But here's the kicker. There's one big thing that I'm going to show you in here. And this is what I have seen and heard from clients that call me. They're not my clients. They're other people's clients that call me and say, can I switch into a Medicare supplement plan? I saw one of your videos. I haven't spoken to my agent in 4 years. I don't even know who the person is. They put me on this plan when I was 65, and now I don't know what to do. This is the big trick. It's not about going to the doctors and spending $30 or $50. People can handle that. What it's really about is your inpatient hospital coverage, number one, as you see from this chart, $275 per day. And this is a cheaper one. A lot of times they could be a lot more. $350, it could be anything. Then the next big thing, and this is why Original Medicare is so important with a gap plan. Skilled nursing facility, if you see here, 0 per day, days 1 through 20. Well, if you have seen some of my other videos, and there'll be links in the description, you'll know that with a Plan G or Plan N, you'll get 100 days of skilled nursing. So you get 0, you get 20 days at 0. With a Medicare, Original Medicare, you'll get up to 100 days if you have a supplement plan. But it says here, $178 per day, days 21 through 100. And that's actually not that bad. I've seen, when I say not that bad, there's other plans that I've seen that are much more than that. So I'm going to look at my calculator. I'm going to do this. 178, so we're talking about 80 days of skilled nursing. 178 times 80 days equals $14,240. Now, most of you might be saying, well, wait a minute. The max out of pocket was under $5,000, so I'm not going to be paying this. But this is what exactly happens. They send you home, and you do not get the care. They don't keep you in there and say, oh, you don't have the money? We'll keep you here, no big deal. No, they say you're not covered, we're going to have to send you home, and then you don't get the care. This is the biggest scam with Medicare Advantage plans that I have ever seen, is with the skilled nursing. Plus the hospital stay, but it's not so much the hospital stay, it's the skilled nursing. Another thing that you have to look at, if I scroll down here, is the ambulance. I've literally talked to people. Ground ambulance on this plan, $250 in network. Air ambulance, 20%. I've talked to people that were so scared that they've taken cabs, or they called their family members to come over before calling an ambulance. That could mean life or death for a lot of people. And this is what happens if you're on a supplement plan that is covered and you're not going to pay for that ambulance. But with these Medicare Advantage plans, they charge you for it. Those are some of the big things. I'm not going to go on and on, but when I say that Medicare wants you to die broke, this 51%, they want this to be 75% in the next 5 years. I think in the next 3 years, they want it to be 75%. And then what's going to happen is when they get a certain amount of people that are under private coverage, they're going to try to push everyone into the Medicare Advantage plans. And I'm telling you, if you watched my video on New York City, Medicare wants something about Medicare wants to take New York. That's what my thumbnail said. No, it was Medicare screws New York. New York is in a lawsuit. It's been going on for years. All the city workers, they took them off of Original Medicare and a supplement plan. They had great coverage that they paid into. They tried to put them on a Medicare Advantage plan. They've been in court for years, and it has been an absolute nightmare, but they're fighting it. And this is what most people are going to have to do. Don't just accept the fact that some local person comes out to your house, sits down and says, I went to this high school, the same high school you did. I'm a nice guy. I'll put you on this Medicare Advantage plan that's 0 premium. Don't fall for that. A lot of people don't understand that the Medicare supplement plans, I've been saying this in all my videos, there is not one person out there that I talk to that is turning 65 or going on Medicare Part B for the first time, meaning going on to Medicare for the first time, that I ever tell them to get on a Medicare Advantage plan, unless it's in the city of Philadelphia where I'm from and I know this one plan and they don't have the money for the supplement plan. Other than that, I would never tell anyone to get on a Medicare Advantage plan when they're starting out in Medicare. I hope this video helped. Like I said, click on some of my other videos. I think you'll be able to learn a lot about the system of Medicare because I show a lot of charts and so forth. I appreciate you watching the video, and I'll see you at the next one.